So, my name is Emily Emerson, and today I'm going to be discussing Parkinson's disease and some of the impacts that it can have biologically, psychologically, and socially. I want to start off with a brief overview of what Parkinson's disease is. So, it's a progressive neurodegenerative disease, meaning that it affects the central nervous system, which is responsible for a lot of different bodily functions, specifically movement. And Parkinson's disease is a movement disorder. Symptoms tend to worsen as the disease progresses. Some of these symptoms include things like tremors, speech changes, and cognitive issues. Currently, there's no cure, but there are medications that can help manage symptoms that I'm going to get into towards the end. Now I want to talk a little bit about the history of Parkinson's disease. Parkinson's gets its name from someone called James Parkinson. He was actually an English physician who was one of the first people to observe and record early symptoms of tremors in patients. He then went on to publish an essay on the shaking palsy in 1817. Jumping forward to the 1960s, researchers have identified low levels of dopamine in the brains of Parkinson's patients, and with this discovery, the medication levodopa was developed, which is a dopamine replacement drug, and it is actually one of the most effective Parkinson's medications out right now. Then in 2000, Michael J. Fox Foundation was launched, which is the foundation that actor Michael J. Fox created after getting the Parkinson's diagnosis himself. So far, they have raised $90 million alone in the US, and I think that is pretty incredible. Alright, now getting into the symptoms of Parkinson's disease. Starting with motor symptoms, which refer to any symptoms that an individual has that affects their balance or movement abilities. Bradykinesia is a slowness in voluntary movements. For example, this is going to be things like buttoning your shirt or moving your hand to open your door, or slowness in your facial movements. Tremors are involuntary shaking movements that are typically seen in the hands of patients. There's also something called rigidity, which is a stiffness in the arms or legs. Patients often find themselves unable to bend those parts of their bodies. Lastly, facial movements can be reduced, muscle fatigue occurs, and difficulties with everyday activities. Non-motor symptoms are symptoms that are not directly related to movement, but still have a significant impact on a person's quality of life. So these symptoms kind of occur before motor symptoms start to appear and even before a Parkinson's diagnosis is given. These include things such as feelings of anxiety and depression, cognitive issues, sleep disturbances, digestive issues, and sensory issues. In terms of risk factors, men are more likely to develop Parkinson's disease. This may be due to exposure to toxins, head trauma, or hormones. 60 years is around the average age for people to start developing Parkinson's. Those with a parent or a sibling actually have double the chance of developing Parkinson's. And in terms of environment exposure to farming chemicals such as pesticides or herbicides can actually increase your chance of developing Parkinson's. Okay, now getting into the biological impact of Parkinson's disease. Parkinson's results in the loss of dopamine-producing neurons or nerve cells. In other words, the neurons in the brain become weak and eventually die. In fact, Parkinson's patients can lose 60 to 80% or more of dopamine-producing cells. There's also a loss of nerve endings that produce norepinephrine, which is the chemical messenger for the area in the central nervous system that controls your pulse and blood pressure. Damaged cells from Parkinson's disease also contain Lewy bodies, which are tiny clumps of protein that once formed damaged brain cells. With psychological impact, it's pretty similar to non-motor symptoms. Patients with Parkinson's describe feelings of anxiety and depression, and apathy, which is an indifference or a lack of interest in activities. This often mimics depression, so it's hard to pinpoint when diagnosing patients with Parkinson's. Moving on to social impact, there's something called facial masking, which results from a person's inability to control their facial movements. These people often struggle to accurately express their emotions to others and are often misjudged for being negative or rude when that's simply not the case. Dysarthria is a disruption of normal speech patterns, and it can make it difficult to communicate with others, resulting in frustration or negative self-perception. Finally, there's the negative stigma that surrounds those with Parkinson's and those with disabilities altogether. It's very harmful and can put people at risk for dehumanization and discrimination. And while there currently isn't a cure for Parkinson's disease, some studies have actually shown a link between exercise and healthy diet to preventing early onset Parkinson's. So exercises that focus on the heart are really important because those with a healthier heart have been known to do better on both cognitive and muscle tests for Parkinson's disease. In terms of diet, you want to focus on fruits and vegetables, lean protein, legumes. The Mediterranean diet's a really good option because lots of the foods in that diet focus on reducing blood pressure. And lastly, in terms of treatment, there are several medications that patients can take to help manage their symptoms, including levodopa, which I have previously talked about. Dopamine agonists mimic dopamine effects. Then there is a MAOB inhibitor, which blocks MAOB, which is the enzyme that kills dopamine. And for those with more severe symptoms, deep brain surgery is an option, in which surgeons will place electrodes into the brain connected to a neurostimulator. And then, of course, therapies such as physical, occupational, and speech therapy are used to help make everyday activities more manageable. And that is the end of my presentation, so thank you for watching.